The latest mass shooting at a college in Oregon could be the spur needed to get a mental health bill some traction in Congress. Representative Tim Murphy of Pennsylvania has been trying to get this measure passed for several years, and he joins us now live from Capitol Hill with more. Good morning to you.
Good morning, Allison.
You've been behind this legislation, as we said in the introduction there, for years. Not just this shooting, but shootings before, hoping it'll go somewhere. How is that hope today?
Well, I've asked the chairman of the Committee on Energy and Commerce, let's set up a date for a markup for a vote on this and move it forward. This bill, H.R. 2646, the Helping Families in Mental Health Crisis Act, is the most comprehensive reform act mental health system in America. It is badly needed. We have to have better access for people who have mental illness. We need more providers. We have to take away the barriers that Medicaid has that say you can't see two doctors on the same day, you can't go to a hospital that has more than 16 beds. We have to make sure parents and families can be more involved. We do know that people with mental illness can, with a lot of help, recover. We do know that people with serious mental illness who are in treatment are 15 times less likely to engage in an act of violence than those who are not in treatment. And we know that as we close down hundreds of thousands of psychiatric hospital beds in this country, the problem hasn't gone away. What's happened is we filled the prisons, we filled homeless shelters, we put people in emergency rooms, and sadly we have filled a lot of cemeteries and morgues. We have to change our system to be one that is more compassionate, direct, evidence-based, and provides care.
As a practicing psychologist, how pervasive is mental illness today in these United States?
About 60 million Americans in any given year will have some diagnosable mental illness, from the very mild transient ones, which we all experience, to more severe ones. About 11 or 12 million Americans with serious mental illness, and sadly about 4 million of those with serious mental illness who are not in treatment. Those are the ones who we should be most concerned about. Part of the reason they're not in treatment is they can't access services, and a big part of it is the nature of their illness. About 40% of those people with serious mental illness do not even recognize they have a problem. Similar to some with Alzheimer's, dementias, or head injury, where they simply have something called anosognosia. They are not aware. We want to make sure that we're able to reach out to them, help families get more involved, and change the trajectory of their lives instead of going down that road of demise, where many of them die 25 years sooner from other medical complications, etc., to one of hope and compassion.
What do you, as we wrap up, what do you feel is the biggest hurdle here? Is it the cost, as other lawmakers see it, or is just a misunderstanding about mental illness as a whole?
There's a misunderstanding of what mental illness is, and there's a misunderstanding of what this bill does. Look, there are some groups that want to maintain the status quo. I get it. Some of them want to keep their jobs and do the same thing. But we have a failing system. While we have seen decreases in mortality rate for heart disease, AIDS, auto accidents, cancer, we've seen increasing rates of suicide and substance abuse deaths. Suicide this year will be 41,000 deaths and 1.2 million suicide attempts. We cannot keep going the same way we are. But that means a lot of members of Congress have to understand we have to make some substantial changes. We have to change the way some agencies practice here. We've had two GAO, General Accounting Office reports, to say the main agency, Substance Abuse and Mental Health Service Administration, wastes a lot of its money on frivolous grants, doesn't even track those grants, and doesn't even spend the money on people with mental illness. That's critically what we have to do in this nation. As the only practicing mental health professional in the federal government, and I've had 40 years of experience in this area, and as with 23 different mental health organizations supporting this bill, we've got to do it. The time is now. Lives are at stake, not only those who are maybe victims of crime, which includes the mentally ill, but those family members who've been suffering in the shadows for too long.
Tim Murphy is the Republican from Pennsylvania, sponsor of this comprehensive mental health bill. Good luck to you, sir.
Thank you very much.